Welcome back to the Defeating Pain podcast. I'm Dr. Ted Artfeld. And in today's episode, we're going to go straight to the lame excuses that are being told to you when certain providers aren't getting anywhere, where they're not getting you out of pain, where they're not getting you moving, where they're not getting you functioning. We're going to go right to all the things they say that's just absolutely incorrect. So if you're getting blamed for no progress, you're going to want to stick around and listen to this episode. You deserve the truth, not blame, not misinformation, and certainly not far-fetched ideas that just says you're not getting the job done. So you're going to want to watch this episode.
Welcome to the Defeating Pain podcast with Dr. Ted Artfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Artfeld.
Okay, let's get into excuse number one. You're just not trying hard enough with your exercise. You're not giving me an effort. Come on. Seriously, let's be honest. If you're not trying hard enough, it's because you haven't bought into what they're trying to sell, or it just isn't working, or you're still in pain with certain movement. It's their job, it's the provider's job to reassess when things aren't working. And when pain is inhibiting movement, hey, let's get some high-tech strategies going to maybe block the pain so you can move, so you can get out of abnormal movement pain behaviors. Here's a thought. Maybe they just don't have those therapies. I guess they probably don't, because they're looking at it from these outdated protocols. We got to do core exercises. We're doing a little resistance band. Let's throw in some dry needling. So those are orthopedic stuff. We're talking about nervous system. If your nervous system is stuck, they're not going to work. You got to have an all-encompassing program to take on that nervous system, and they're not equipped to do that. That's the real reason. It's not your fault. It's theirs. Excuse number two. Hey, we just need more time. Oh man, I've had so many patients come back to me that have been in PT for 8 weeks or 10 weeks, and they're still not any better. And they go to the PT and they say, we just need to stay with it. We just got to keep going. It's not any better because we just haven't had enough time. What's enough time? I'll tell you what's enough time. Good clinical guidelines state that within 2 weeks, if you're not feeling any better, they should be doing something different. If after 4 weeks of care, you're not feeling any better, you should be out of there. They should be totally out in someplace else. And that goes for chiropractic care as well. I'm not going to just pick on PTs because we have a lot of chiropractors that have you. And I know I just said in the last episode, keep coming back, come back. Sometimes the ones that, I don't want to say that. There are some that do want you to keep coming back, coming back. I got to call it like I see it. If you're not any better within 4 weeks of care or see an improvement, that place, wherever you're at, PT or chiropractic, is not getting the job done and something has to change. Yeah, it's a stall tactic, basically. But if you're using neurological rehabilitation techniques for what used to be an orthopedic problem, heck, you could even use neural rehab techs for an orthopedic problem and still get unbelievable results. And you can get back to doing what you want to do very quickly. And you feel in charge. Yeah, I like that. Okay. Excuse number three. We've tried everything. Nothing else will work. And then you say, man, that's a buzzkill. That's a hope killer. And the reality is they haven't looked at the nervous system. And heaven forbid if you say, well, do you think I ought to try chiropractic care? And they're going to say, oh, heavens no. Chiropractors are just going to adjust the spine, and that's not going to do it. You don't need more time. And if nothing else has worked, well, yeah, maybe nothing else will work in their office. So you got to find someplace else to go to. That's why we're doing this Defeating Pain podcast to let you know there are other options. You know what some of the options are? You can do them at home. You can do BioWave Go at home to get yourself under control with pain. You can do brain tap entrainment therapy to get sleep and also help with your pain. And then you can start your own gym, your own fitness center right in your house with our neurological PRS unit. Yep, you can. Check out the links below. Send me a message or comment, and I'll tell you more about it. The other thing that drives me crazy are the lies they tell about chiropractic, and we went over this in the last episode. Chiropractors aren't real doctors. We're not RDs, okay? That's false. We've had the training. We understand anatomy, physiology. We understand the nervous system, and we are often the only ones doing full body assessments on movement and function. Wow, there's a concept, right? Chiropractic is dangerous. Absolutely not. No more dangerous than Tylenol, massage therapy, or crossing the street. Spinal manipulation is supported by research and used safely every day across the world. Across the world. Oh, those chiropractors, they're just going to crack your back. They don't do rehab. Well, we're not going to crack anything, first of all. And they haven't seen our clinic, number two. And we combine neurological therapy with everything we do. Yeah. Do I do spinal manipulations? Yes. There are a variety of spinal manipulation techniques. You don't need to hear the crack, okay, or the pop. There's a lot of things that we do that do not generate that type of sound and that were very effective. We use brain tap. We use BioWave Go. We use kinetisense for movement of their analysis. We use neck care for cervical spine to see how the neck is moving and what's going on with the neck. And we use a lot of different things, really cool things. And a lot of these cool things you can do at home, which makes them even cooler, which is cool. I probably should stop saying cool. But anyway, you get the drift. So here's what I tell every patient. If they're in PT right now and they're coming into my office and they say, I'm just not getting any better. And I said, how long has it been? And they said, it's been 6 weeks. And I'll say, you're not going to. I'm sorry. I hate to break the news to you. I don't care what they're telling you. If it's been 6 weeks and you're not any better, you're not going to get better. That's not your fault. You just haven't been given the right therapy for what's really going on. And we do that. We do that at our clinic. There's a lot of things you can do at home now. And that's what I really want you to do. I want you to take control of your own rehab from the comfort of your own home. That way you're not stressing about office visits. You're not taking time out of your busy schedule. And more importantly, you can get more rehab done at your home that you can in any clinic. And you know what? You get the tools and you commit to it. You're going to be trying because you want to get back to living your life, right? So I tell you what, if you ever felt a little gaslit by a provider who couldn't get results, share this episode. You're not alone. You're not broken. Like it, comment, subscribe to the podcast. Hey, in our next episode, this is going to be one of my favorite ones. We're going to discuss 3 reasons why disc pain doesn't respond to traditional therapy like spinal injection. They will a little bit, but it's not a cure. Laser therapy, spinal decompression. Yeah, physical therapy where they go, we got to strengthen up that core. It's all about core. It's not all about core. You know what it's really about? It's about the multifidus muscle. That is your homework. Google multifidus. It's spelled out below. All right. I'll see you in the next episode.